on 5 fraud and abuse laws that all healthcare organizations and providers must be familiar with, and these include radiology providers. So we will talk about the Anti-Kickback Statute. We'll talk about the Stark Law, which is also known as the Physician Self-Referral Law. We'll talk about the False Claims Act, and also cover the Civil Monetary Penalties Law and the Exclusion Statute. So starting off with the Federal Anti-Kickback Statute, the quick summary on this is that this statute prohibits you from providing a referring physician with anything of value in exchange for referrals. So what's the fine print? The Anti-Kickback Statute specifically makes it a crime to, for healthcare programs, government-run healthcare programs, to be billed for items or services that were the result of a kickback to the referring physician. And so this is a criminal and civil law, and it's important to understand that it is against the law to either provide the kickback or to accept the kickback. Now, this law requires that the government prove that that was your intent in order to establish liability. So, we'll kind of get into details on that a little bit more as the session goes on, but that is an important element of their case. It's also really important to make note of the fact that what we're discussing is the Federal Anti-Kickback Statute, but many states have come up with their own versions of this law, which may be slightly different than the federal rules. So wherever you're located, you want to look at what's required locally as well as on the federal level. Now, anti-kickback is enforced by the Department of Justice. This one can include, as I said, imprisonment or fines, because it's both a criminal and civil law. And these claims can also now be prosecuted under the False Claims Act in addition to this act itself. So there are exceptions to anti-kickback. These are known as safe harbors. And what a safe harbor is a business arrangement that satisfies some exception to the statute, despite the fact that it may have the appearance of a kickback. So what are some examples? Investment interest. If a referring physician has a bona fide investment in a healthcare organization and they receive dividends related to that investment, it may appear to be a kickback, but in fact it can satisfy this exception. There are other exceptions. It's important to understand that when you're trying to fit into one of these safe harbors, you have to meet all of the conditions to fit into the safe harbor. So when trying to pursue this, you can work with your legal counsel to determine if you meet all of the conditions of the safe harbor, or providers can go directly to the OIG to determine if a practice is prohibited by the law, or determine if what they're contemplating fits into a safe harbor. So what does this mean in really, kind of common sense terms? These are some problem marketing activities under anti-kickback. So again, keep in mind that the key concept is providing something in exchange for referrals. So when you are doing that, there will be a problem. So don't establish a program to provide thank you gifts for referrals when the referring physician reaches a certain volume of referrals. That's not a good practice under your marketing program. Don't offer perks such as free imaging scans to your best referrers, indicating if you send me a lot of patients, I'm going to give you things. That is a problem under AKS. Don't ever, promise to take a physician to dinner or provide a gift if they will start referring patients. And another thing that comes up is don't, agree to sort of cross-referral as an incentive. So, don't have your radiologist agree to always recommend the referring physician services in exchange for referrals from that referring physician. So this is an example of something that happened long ago. So when I first started out my career in radiology, I was a sales rep for an imaging center, and there was a chiropractor that I was trying to target as a new referring physician. And I called on him several times, and I wasn't really getting anywhere. And so he finally leveled with me and said, look, I am involved with a local sporting event, and I prefer to send my patients to the imaging center that supports that event every year as a sponsor. And then he asked me if I would like to become a sponsor for the event myself as a way to establish a closer relationship with his practice. So is this a problem? The answer is potentially yes. The implication from him was clear. He was saying if I supported the sporting event, he would refer patients to me. Now, getting into the details, in evaluating whether this is problematic, you might want to find out, would he be personally benefiting from the event financially? So perhaps the chiropractor was simply involved in this event because it was really meaningful to him, and he was donating his time. This was a charitable function, and he simply was encouraging other people to support the cause. If he's not benefiting, personally from a financial perspective, probably wouldn't be considered a kickback under the statute. On the other hand, if he is a paid medical director for the event, then I think that would be problematic. Another thing to consider, unique to this example is that, is he referring any federally funded patients to you? Because a lot of times chiropractors can't be referring for certain types of imaging studies if the patient has Medicare or Medicaid. So those are some evaluation questions, but this is a potentially problematic scenario. So moving on to the Stark Law, this is also known as the Physician Self-Referral Law. And what the Stark Law says is that if you have a financial relationship with a referring physician, they can't send their Medicare patients to you for imaging services. So this applies only to Medicare patients. The fine print on Stark is that there are a list of designated health services that are implicated in this law. And radiology and nuclear medicine are on that list. These are types of designated health services. And so Stark's a civil law, and it prohibits any doctor, dentist, podiatrist, or chiropractor from referring Medicare patients for designated health services, i.e. imaging services, if they or an immediate member of their family has any kind of compensation arrangement with the healthcare entity. So that could be salary, it could be paid medical directorships, it could be investments. And with Stark, it's a strict liability law. So they don't have to prove that you intended to violate the law, only that a prohibited referral took place where a financial relationship exists. Now, like AKS, this is enforced in a variety of through a variety of mechanisms, and they can include, exclusion from federal programs, fines, a disallowance period from Medicare. So basically, during the whole time that you were receiving improper referrals under Stark, all of your billing could be disallowed. And this, too, can be prosecuted then as a false claim. So like AKS, there are exceptions. So in certain scenarios, you can fit into a safe harbor, and some of the more commonplace exceptions to Stark would be, for example, the in-office ancillary services exception. This is what allows, say, an orthopedic surgery group to put an MRI machine in their office and use it with their patients. Another type of exception is office space and equipment leases. So you can lease equipment, but it has to be in a written lease. There must be a term of at least a year, and fees need to be set at fair market value. Now, another exception, which I just sort of touched on, is employment. And a bona fide employment arrangement can fit into the Stark Law exception. And this is when, this is not a, quote, a paid medical directorship in quotes where no actual work is performed. But if a physician, for example, is employed by a hospital, then they're allowed to refer their patients to the hospital. for services. So, again, one of my own examples from my career when I was working as a manager of imaging centers. I held an open house and for a new facility, and a referring physician contacted me after the open house, and he said, look, I understand you have some excess office space that is unused there. I noticed it. And I'm wondering if you would be interested in subleasing that to me so I can perform pain management procedures for my patients. I was very interested in leasing the space to him and told him that I would get him a contract over. And when I said that, he sort of hemmed and hawed, and he said, well, I was thinking because I'm going to be, needing to get an MRI on each of these patients, and me being there, I'm going to be in a position to refer you a lot more patients. I was thinking maybe we could just work something out on the rent. And I think by that he meant charge him nothing or a very low fee. So is that a problem? Definitely. This doctor would have been referring Medicare patients to the center, and in order to gain a Stark exception for subleased office space, the rent had to be set at fair market value for the space. I mean, in this scenario, charging him anything less than I was paying in the primary lease for the space would be very, very difficult to defend. And what he was promising was more referrals in exchange for low rent. So that would be a problem. Before we go on, we're going to get into some other issues with Stark, but does anybody have any questions so far? Okay. So let's get into another type of Stark exception that's very specific and relevant, and that is the non-monetary compensation exception. So what this means is when you are doing marketing to referring physicians, you need to limit how much you're spending on gifts and entertainment in order to avoid creating what's considered a financial relationship under Stark. You want to be able to engage in marketing efforts without having to refuse Medicare referrals from physicians. And so the way to do that is to fit within this exception. Now, the non-monetary compensation exception only applies to non-cash compensation. So you can't ever give a referring physician a cash equivalent. That means no gift cards, no gift certificates. The next part of the exception is that you can provide marketing, gifts or entertainment, but they can't be solicited. So the physician or their office staff cannot call you up and say, hey, please bring bagels to our office this morning. The other thing is that the provision of the item or service cannot take into account the volume or value of referrals. So you can't say, well, this physician sends me a ton of patients. I'm going to, take them out to, a much nicer place than I would normally take a referring physician for a meeting. The other thing is that the compensation can't violate the Anti-Kickback Statute. So, again, no matter how minimal the cost of the item is, you can't give it conditionally on receiving referrals or saying I want referrals in exchange for this gift. And CMS sets an annual limit of how much you are allowed to spend on non-monetary compensation items for physicians, and in 2013, the dollar limit is $380. Now, for those of you that work in a hospital, there is one additional caveat, and hospitals are allowed to hold one medical staff appreciation event per year where referring physicians are invited, provided that this is truly a hospital with an organized medical staff and the cost of the event stays within the annual limit, which this year is $32 a physician. So hospitals can, in addition to the $380, have that one sort of medical staff appreciation event per year. So, how do you ensure that you're not spending more than the limit? You've got to track it. And you really want to ensure that you set up a system where everybody that's potentially spending or providing items of a value to physicians are documenting that, and that someone in a management capacity is monitoring how much is being spent to make sure those limits aren't exceeded. So when you are setting up your tracking system, you need to document the actual cost of the item, not the value. Now, what does this mean? If you won tickets to a sporting event for free in a contest, but you couldn't go on that day, and you decided to give those tickets that you paid nothing for to a referring physician, you can do that, and you don't have to document that you spent anything on the item. On the other hand, if you wanted to provide tickets to a sporting event to a referring physician, and you paid triple the face value of the ticket to buy them, you have to record what you actually paid for the ticket, not just the value. So that's an important part people often ask me questions about. Now, the kinds of things you need to document, meals, lunches, taking people out to dinner, bringing in treats or snacks for the office. If you bring in cookies, if you bring in bagels for breakfast, you need to document that. As I said, tickets to events, sporting events, concerts, and if you are taking a physician to an event, like if you hire a car service, you have to also document the cost of that transportation, what you paid for that. Flowers, you know, a doctor has a baby and you send flowers, that has to be documented. Holiday gifts, if you take a gift basket or poinsettia in you know, Christmas time, you need to document that. Rounds of golf. You know, one of the things that's on the list are use of vacation homes. I always kind of scratch my head on this one because I don't know how many vacation homes you could provide use of where the value would be under that $380 limit, but it is on the list. So as I said, you've got to document all of it. You've got to monitor it. Customer relationship management software works really well for this. So having a technology solution where everybody can keep track of it is a good way to do that. So here's another example of something. Go ahead.
I'm sorry, let me continue. Yeah, I wanted to bring up, this is a question that's been brought to me a few times, and it's about open houses.
Mm-hmm.
And how to kind of document expenses, if any, that can be applied on an open house.
So it kind of depends how you structure the open house. My take on that is that if it is truly an open house where not only are referring physicians free to attend, but it is open to the public, doesn't mean you have to market it to the public, but if you would allow anybody in the neighborhood to walk in for the open house, then I don't think it's necessary to record the cost of, you know, the appetizers and drinks that you provide at the open house, provided those things are, you know, sort of within reason. What is potentially a problem is if it is only open to referring physicians and you don't make it open to the public. The more conservative way to approach it might be to document a cost for each of those physicians. The other thing I would be very mindful of is sometimes at open houses, people like to do giveaways. You know, hey, we're going to have a drawing for a widescreen TV. Whether it's open to the public or not, if a physician or someone that works in that physician's office wins that drawing and gets an item of value as a door prize, I would document that because that one would certainly seem to qualify for something that should be tracked. Does that answer your question?
Yes, it does. And I guess this would be a good point to see if anybody else had any questions. Okay. So another example, back again when I was a sales manager for imaging centers. One day I got a call from one of my reps, and he wanted to know if I would let him take Dr. Smith, who is our top referring physician, to play a round of golf. Now, I didn't normally approve this type of entertainment. It's expensive, right? But then I wondered to myself, should I do it? And if I do it, is it a problem if I do it? So the answer is it depends. First, it would depend upon how much the golf outing was likely to cost and how much had already been spent that year on Dr. Smith. If we're bumping up against his upper limit, it could be a problem.
the other thing is it would also depend on whose idea it was to play golf. If my rep said, I want to take Dr. Smith to play golf because I want to talk to him about a new service, and it seems like I can't get any of his time at the office, that could potentially be a problem. However, if Dr. Smith called up and said, hey, how come you never take me to play golf? I want you to take me out, then that could be an issue. So if he specifically requested the entertainment, it wouldn't meet the exception. Finally, whether or not this is acceptable with the
Oh, that's right. Yeah.
Hello?
Yeah, of course.
Okay. So it would depend
if
on
everybody
whether
could mute their if everybody could mute their phones again, I'd appreciate it.
Okay.
Go ahead, Terry.
So finally, it would depend on whether I made the decision based on how much he referred. If I decided to make an exception to my golf policy solely based upon the fact that he was our top referring physician, that would not, be kosher in terms of complying with this exception, because I would be making that decision based upon the volume and value of the services. So another example, when I was a sales rep, I got a call one day. My boss told me, good news, I've ordered holiday gift baskets, and we're going to distribute those in December to our top referrers. And here's what I want you to do, Terry. I want you to make me a spreadsheet and show all of your referring physicians for your facility and how much volume each of them sends each year, because I want to make sure that we give the biggest baskets to the groups that send the best, the most referrals. So, is this a problem? Definitely, and it was an awkward position for me to be in. So what I had to do was let my boss know that a better approach would probably, from a compliance perspective, would be to think about this differently, that we didn't want to be creating a spreadsheet and plotting out who should get the biggest gifts based upon their value and volume of referrals. And so what we did instead is we looked at the size of the offices, how many people worked there. We gave the larger baskets to the office with more people working there, simply to make sure that everybody got a chance to enjoy the treats. And that was a better way to do it. Before we go on to the False Claims Act, does anybody have any questions about Stark? Okay. So moving on, the False Claims Act is a very old statute, originated back during the Civil War, and it was because there were contractors who were ripping off the government. They were selling supplies for the troops that were inferior or falling apart, and so the False Claims Act was promulgated to protect the government from being overcharged or paying for shoddy products and services. This now is applied in healthcare, and the way that it's applied is that if someone makes a referral and submits a claim to the government that was prohibited by some other law, so the claim originated because a kickback was paid to a referring physician, or claim originated from a referral that was made in violation of the Stark Law, or you could simply just bill the government for a service that was never provided. Or upcode the service. If you do those things, you will be guilty of the False Claims Act. Now, the False Claims Act is really important because this is what provides the whistleblower provision. This is how whistleblowers can file a lawsuit on behalf of the government. That's called a ketam lawsuit. And when that happens, if the suit is successful, then the private citizen, the whistleblower, who could be your competitor, who could be your employee, could just be a patient, that whistleblower receives a portion of the money recovered from the that the government recovers from the person who violated the act. So this one's tricky, and it's the way a lot of people get into trouble on compliance, because anybody potentially can be acting on the government's behalf. Again, this is a statute where intent is not necessary. They don't have to prove you were intending to defraud the government. Just simply being ignorant or disregarding the law is necessary, or is all that's necessary. This one's also enforced both civilly and criminally, so there can be imprisonment, there can be fines. These fines can add up extremely quickly because, for example, if you were receiving referrals on an ongoing basis over the course of a year that were deemed to be a violation of the Stark law, the government can fine you not only 3 times their losses on the claims, but they can fine you $11,000 per false claim submitted. So this one adds up very quickly. Now another law that exists as a way to impose penalties is the civil monetary penalties law. This is something CMS can use to punish for violations of their healthcare programs. They can use this as a way to penalize for violating Anti-Kickback, False Claims Act. They also can use this to penalize people who violate, for example, the terms of their provider agreement with Medicare, or for providing false or misleading information on your enrollment application with the government. And so this one's enforced by the OIG, and fines range from $10,000 to $50,000 violation. And then the final law that I want to talk about is the exclusion statute, and this one can really shut you down for good. And what the exclusion statute does, it gives CMS a mechanism to say we're not going to continue to do business with people who have been convicted of healthcare fraud or patient abuse or other types of misconduct. And there are 2 scenarios with exclusion. There are some circumstances where the government is required to exclude you. So if you are, for example, convicted of healthcare-related fraud, you must be excluded from not just Medicare, but Medicaid, the Veterans Health Care Administration, TRICARE. There are also other offenses that CMS has the discretion to impose exclusion. They don't have to, but they can. This can happen when your professional competence is substandard. They can even exclude physicians who default on their med school loans. Exclusion is, like I said, very tough because it's once, as a practical matter, once you are excluded from all the federal health care programs, it's very difficult to continue to do business, even, even with commercial payers. Oftentimes, this can spell the end of someone's organization or practice. In summary, marketing programs for imaging centers, they're necessary, right? You need to build your volume. They're not bad things, they're good things, but you have to handle them carefully because, you're trying to increase the value of your organization, but if you violate, federal requirements as you do it, you can expose not only your organization, but also yourself personally to prosecution, fines, and imprisonment for compliance violations. My advice is, and I've been on both sides of this, I've been in marketing, I've been in sales, and I'm, a compliance professional. If you have doubts about the permissibility of something, be very conservative. Do your homework before you move forward. If it's risky, it may very well not be worth it. One just very, very easy rule: referrers should never be asking you for things. They should not be asking you for money or gifts or perks. It's just not an acceptable practice. And finally, whenever you're providing any item or service of value to a referring physician, you should carefully document that. And you do it so that you can ensure you don't exceed those annual limits, and you document it so that you can prove that you didn't exceed those annual limits if you are audited. Does anybody have any other questions for me before I turn this over to Glenn? Okay, just one final word. I want to let you know that my consulting practice, Accountable Radiology Advisors, helps radiology providers. We work on things like growing volume. We work on compliance with regulatory requirements, also consult on efficiency and how to reduce operational expenses and how to reduce malpractice expenses for the professional component of service through improved quality and safety. So if you want any more information about what we do, you can visit www.accountableradiologyadvisors.com. And Glenn, I will turn this over to you.
I have a question.
Certainly.
Hey,
Go ahead.
Quick question. And this may be something Glenn touches on, I'm not quite sure, but do you have any comments on relationships with vendors who help fund some of the education events and that type of thing?
Well, I think those things can be done. They have to be done, you know, in a way that is compliant with the requirements placed on that vendor. And, you know, for example, the pharmaceutical industry has really come under a lot of scrutiny, and they have a lot more, you know, sort of, you know, restraints on them today than they did, you know, 15 years ago when I first got into radiology. So, you know, Covidian is not necessarily in the same position to help support those events, both through company policy and pharmaceutical industry, you know, choices about self-regulation. Other vendors, you know, GE, you know, Philips, Siemens, you know, they sell you a piece of equipment. You know, sometimes they will help fund some marketing programs, build things like that into the deal. But again, you have to work within the confines of what's permissible there. You know, at the end of the day, let's say you want to host an open house. You know, the same kind of criteria apply whether you should document it, no matter who's paying the bill for that open house. If, you know, GE gives you a, you know, a $2,000, you know, sort of, you know, a budget and bake that into your deal to do an open house, you still, if you're going to give away an expensive door prize to a physician, better document it. To be on the safe side. You really can't sort of get around that because the original funding came from GE. You know, my position is if it looks like a duck, if it quacks like a duck, it's a duck. So, you know, I don't know if that gets at what you're talking about, but I think I would, you know, just no matter who the source of funding is, whether it's your organization directly or, you know, a vendor who's supporting your organization, you probably need to interact in the same way with referring physicians.
Thank you.
Any other questions? Okay, Glenn?
Well, Terry, I appreciate it, and everybody, I appreciate your time on here. Just as a quick overview, the reason that IDS is hosting this is we do have a CRM application called Abadox CRM, and we do allow you to track expenses to help maintain compliance with all these federal regulations that Terry just discussed with you. In addition to that, we can run a number of analytical studies, giving you an idea of where your study volumes are actually coming from, the trends that are taking place, even something as simple as identifying clusters of where your facility is versus where your location, your referring physicians are. And we can also provide you with an overview of what your marketers are actually doing for you, the investments that you're making in marketing. So we can help you track down what they're doing by the location, how often they're visiting somebody, how often they're scheduling out in advance. And we also have a mobile companion that can actually help people, you know, kind of a guerrilla tactic. They're staying outside the door. They want to know prior to going in there, is this going to be a satisfied physician or is it someone who is in need of help, and it's just kind of arming you with the information. So that's kind of the overview of Abadox CRM. I'm sure there are a lot of you that we've already spoken about it once or twice, but I wanted to again thank Terry for hosting this and everybody's time today. We will be sending out a PDF version of the presentation, and if you do need to reach Terry, here is her email address as well as the her website to get a little more information about accountable radiology advisors. And if you ever needed to reach me or anybody here at IDS about Abadox CRM or any of the other radiology solutions that we provide, you can reach me individually or you can contact us at info@idssite.com. Again, thank you everybody for your time. If there's any questions, now would be a good time. Otherwise, look for the PDF in the next day or so.
Thank you so much, Glenn.
Thank you very much, everybody. Take care.